So this is called the CIWA. CIWA stands for Clinical Institute Withdrawal Assessment for Alcohol. So this is the paper form. So remember, we have a paper form for every one of our digital forms, and this is the paper form that goes over the alcohol assessment or screening. So the nurse would put in the date, the name, the date of birth, their ID number, and then they would basically just start going through all of these different assessment tools. So the first one is the nurse's initials, the time, and then we're putting in the vital signs, the blood pressure, the pulse, the respiratory rate, temperature, pulse oximetry. We're also, for those of you that are not familiar with this process, we hand out cups of Gatorade or some type of fluid electrolytes. So we want to replace their electrolytes because everybody that's going through withdrawals possibly has the risk for becoming dehydrated. They could be vomiting, and they could be getting rid of fluids that way. They could have diarrhea. They could be urinating excessively. So if that's the case, we want to make sure that we're replacing those fluids. So twice a day, we're going by and we're offering them Gatorade. At some of our facilities, they actually have Gatorade on the unit, and the inmates can just grab it as they wish, which I think that's good practice because it's kind of crazy to restrict electrolytes when people are, have the potential to become dehydrated. So to just offer it twice a day, that's good, but it's better to have this available as needed whenever they want to drink it. We also ask them right up front. Like I told you, people that are going through withdrawals, sometimes they start thinking about suicide. So we want to ask them right away. And there's this false conception that if you ask somebody, if you're suicidal, that you're going to put the thought into their head. This is so that if somebody is thinking about it, you know, most likely if somebody's thinking about it, they may tell you, they may say, "Hey, I'm suicidal. You're right, I am." And a lot of times, at that initial point, they're kind of reaching out for help. Um, we don't want to wait until they're actually trying to attempt it. So we want to kind of intervene before. And some people, they'll start crying right at the medication cart, and they'll just start crying and saying, "Yes, I'm suicidal. Can I talk to somebody?" So that's why we ask these questions right up front. Um, a lot of these uh, a lot of these screening tools are just observation, and it says right here, observation. So, you know, um, we're looking at them. Are they nauseated? Are they vomiting? We ask the questions also. Are they having any tactile disturbances? Have you had any itching, pins and needle sensations? Any burning? Any numbness? Do you feel any bugs crawling on your skin? We're looking to see if they have tremors. We're looking to see if they're having any auditory disturbances. Are they seeing things or hearing things that aren't there? Visual disturbances. Again, are they seeing things, or does the light like seem too bright to them? We're looking at their skin to see if they're sweating. We're trying to determine, whether they're having anxiety or agitation. We're asking them if they have any headache. And then we're also, making sure that they're oriented. We're saying, what day is this? Where are you? Who are you? Can you tell me your name? Can you tell me what day it is? Can you tell me where you're at? This is a really, really important question for the people who are withdrawing from alcohol, because a lot of times, they could seem normal to you, but you ask them where are they at, and they'll tell you that they're on vacation at the beach or something, or they're staying at a homeless shelter, and you're like, you're in a jail, and then they'll kind of start arguing with you. So that question is like super important. I see a lot of staff miss that, so that's super important. Remember that. The nurses need to be putting their signatures in here and filling out this form completely, because when this gets handed to medical records, they need to identify this patient and make sure that this form um, gets into the appropriate chart. But remember, we have a digital form, so As long as the Wi-Fi is working, the internet's working, we got power, we're going to be using the EMR.